Now, it is my great pleasure to introduce our speaker for today, Professor Ajesh George, Professor of Interprofessional Oral Health at Western Sydney University School of Nursing and Midwifery and Honorary Professor at the University of Sydney School of Dentistry. With a background in dentistry, he specialises in interdisciplinary oral health care and is globally recognised for training medical, nursing, midwifery and allied health professionals to integrate oral health into clinical practice. Professor George is the director and co-founder of the Australian Centre for Integration of Oral Health, a national centre fostering collaboration across disciplines to embed oral health into primary care. His work, acknowledged by the World Health Organization, has influenced policy and practice and led to a paradigm shift in oral health care. Professor George's commitment extends to mentoring PhD students, academics, and clinicians, earning him recognition as one of the top 2% of scientists worldwide. Isn't that great? Professor George, it gives me great pleasure to welcome you back to the university, and I invite you to deliver the occasional address.
Thank you very much for that kind introduction. Vice-Chancellor, faculty deans, university staff, distinguished guests, family, friends, and most importantly, the amazing graduates here. I'd like to start by thanking the University of Sydney for giving me this opportunity to address you today. I'm truly honored and humbled to be able to share this momentous occasion with you on one of the most important days of your life. Graduates, today marks the culmination of years of blood, sweat, and tears, with lots of ups and downs, including the pandemic, but you have persevered and come out on top. This is no mean feat, and I congratulate you on reaching this significant milestone in your life. However, you've not been alone. You've had a support team that has been there for you and spurred you on, especially in times of need. So today is also a celebration of your family and friends, and their unwavering support that has helped you reach this point. You should all be extremely proud of what you've achieved as a team. As a parent, this is a time when you can truly breathe a sigh of relief, knowing that your child has passed one of their biggest tests in life and is ready to take on the world. I know very well all the emotions you're going through because I was in your exact same position this morning attending my daughter's graduation. Graduates, you now have the foundational knowledge and training to enter the workforce, but your education hasn't stopped. You now need to learn how best to apply that knowledge into practice so you can grow your career and provide the best quality care to your patients. To help you navigate that journey, I'm going to share with you 3 stories from my life. My first story is about staying hungry and challenging the status quo. Back in 2008, as a new academic, I began looking at different ways we could improve oral health care in Australia to support the dental workforce. So I started exploring whether other professions like midwifery could promote oral health. Back then, this was unheard of, and there was a lot of resistance to this idea, especially as this was not what midwives did during pregnancy. Numerous senior academics and clinicians even discouraged me to pursue the idea. I would often hear passing comments like, "There goes the pregnancy man again." All this was quite disheartening and disappointing, and I started doubting myself as I was a nobody then. However, I believed in the idea and was passionate about doing something different, so I continued to advocate and slowly found allies to bring about change. It was definitely a struggle, but what has materialized since then has been absolutely amazing. The midwifery oral health program was adopted into policy and rolled out across Australia. It was endorsed by the World Health Organization and is currently being tailored to countries internationally. That idea also led to the genesis of our national center, where we are replicating that concept with other health disciplines and helping population groups across the lifespan. We now even have universities in Australia where nurses and allied health professionals are being trained in oral health, a real paradigm shift in oral health care. So graduates, as you enter the workforce, don't be afraid to challenge the current norms and explore new ways for providing quality care. The way healthcare is delivered is constantly changing around us with advances in technology and new concepts. So be willing to adapt and become leaders and innovators for change. It may not be easy and you will face challenges along the way, but believe in yourself and know that you have the power to make a difference in our healthcare system, to benefit patients and our community. My second story is about grabbing opportunities and learning to accept failure. The year was 2000. I just got married when I took a bold decision to come to Australia as an international student to study my master's. However, very soon after arriving, things started getting difficult, and everything that could go wrong happened. I couldn't find a part-time job to support myself, and after 4 months, I was down to my last $200, relying on instant noodles most of the time. To make matters worse, my wife's visa application to join me was rejected. I was devastated. All my plans had failed, and my whole world came crashing down. Eventually, I did find a casual job working at Donut King, making $7 an hour. It wasn't a lot of money, but it was something. And I remember my first proper meal in a restaurant after that, fried chicken and mash. Boy, did it taste good. It wasn't easy continuing, and there were numerous instances where I wanted to give up and leave Australia. It was truly one of the lowest and loneliest periods of my life. But one day, I came across an ad at the university promoting research internships at a hospital in Sydney. The pay wasn't great and was quite far from where I lived, but my gut told me to apply. That one decision changed my life forever and put me in a path that I never imagined. I met a wonderful professor of nursing who became my mentor and opened my eyes to the world of research. And through her support, I managed to move permanently to Australia with family, get my first research job, and commence a PhD. Throughout that whole journey, I took whatever opportunities came my way, not knowing where my professional life was headed. And it was only after my doctorate did I find my true passion that jump-started my career. Although it did not make sense at the time, when I reflect back, I can clearly see how each one of my experiences helped shape me, shape who I am today, and contribute to my career. The failures I encountered early in my career made me resilient, while my experiences in customer service and with the nursing profession taught me the importance of mutual respect and dignity of labor, all of which were crucial when I started pushing the idea of interprofessional oral health care. So graduates, remember, career progression is rarely linear. You will encounter failures and disappointments along the way that could change your career direction. But that's okay. Failure is the first step to success and is a vital part of your learning experience. Use those experiences and learn from them to drive you. Intelligence can only get you so far in your career. It is resilience, grit, and character that will take you all the way. Remember also that you can't rush your career progression. It takes time. All you can do is grab whatever opportunities come your way and trust that each of those doors will lead you on your path and give you confidence to find your passion. My final story is about finding a support team and being an integrated clinician. When I look back at my career, I can say for certain I would never have succeeded without mentors helping me at crucial time points and supportive colleagues with a shared vision of improving care. Graduates, you've had one team that has helped you reach this point. You now need to find another support team in your workplace to grow your career. People having mutual respect, shared goals, and unique strengths that you can trust to support your ideas and collectively drive innovation. This is one of the main reasons why I've continued to be associated with the School of Nursing and Midwifery, even though I have a dental background, because that is where I found my support team to drive change in oral health care. The trick, though, is knowing how to maintain this team. So it's important for you to balance your personal career ambition with the needs of your colleagues to ensure success for everyone. As the saying goes, there is no I in team, but there is me. As you enter the workforce, it is equally important that you start thinking like an integrated clinician. Your close and ongoing relationship with patients gives you a unique opportunity to look beyond your area, whether it's oral health or nutrition, and provide holistic care to your patients. Health systems around the country are already adopting integrated models to transform patient care through interdisciplinary collaboration. This is especially important for the dental profession, which has traditionally worked in silos. We need to change this and get the dental and broader health workforce to work more closely together as a team. Even the World Health Organization is advocating for this in their new Global Oral Health Action Plan. In fact, we're already seeing examples of this in New South Wales, where dietitians are screening for poor oral health among at-risk population groups, while public dental practitioners are undertaking height and weight screening to address childhood obesity. So graduates, a change is happening around us, and you need to be open to embracing new models and becoming champions in integrated care. I've seen firsthand the benefits of being an integrated clinician, and I guarantee you will make a difference. So to conclude, I'd like to once again congratulate the graduates and wish you all the success as you embark on the next chapter in your life. Be hungry, find your passion, and be resilient. I'll leave you with a final quote from Winston Churchill. Success is not final. Failure is not fatal. It is the courage to continue that counts. Thank you.
Well, what a great address. Thank you so much for sharing your story and journey with us. So let's give one more round of applause to thank Professor Ajesh George.